This is Owen. He is a little over 6 months old. He was born with craniosynostosis, which is a premature fusion of his skull plates. So our pediatrician pointed it out to us when he was 2 months old and said, you need to go see a neurosurgeon.
To understand what craniosynostosis is, you have to understand what the skull looks like. So the skull is made up of multiple bones connected by sutures, which are growth centers of the skull. In the front here, you can see the fontanelle or the soft spot. In the front, this is the metopic suture, coronal sutures, sagittal suture, and these are the lambdoid sutures. The metopic suture is the first to close, and that usually closes in the first 2 years of life, usually around 9 months of age. These sutures in the back, the coronal, the sagittal, the lambdoid, those usually close a lot later in the second decade of life. So when these sutures close in a child, it's definitely abnormal.
When you take a look at this CAT scan or CT scan of the head, you can see the normal growth plates at the back of the head, the normal growth plates in the front of the head, and the one towards the face. When you look at the top, the growth plate here has already closed too early. This patient is 6 months of age. Usually this doesn't close until over 1 year of age. So this is what you'd consider craniosynostosis. The result is that this does not allow the head to grow side to side, and so the head grows from the growth plates here and becomes long front to back.
So there's multiple ways that kids are referred. Typically it usually comes from either a pediatrician or a family practice doctor that sends the patient in to see us. Some kids will already be diagnosed with craniosynostosis either through an x-ray or a CT scan, but a lot of kids are referred with abnormal head shape. So the first part of when they come in is deciding, is this craniosynostosis or is this something else? There's another condition called positional plagiocephaly that's caused by child laying in a certain position and causing an abnormal head shape. So that's the first thing we do is to make sure we know what the diagnosis is.
What happens during the day of the operation is that you and your child come into the preoperative area in the morning. At that point, you do get to meet the team, which is composed of the neurosurgeons, the plastic surgeons, and the pediatric anesthesia team. So we'll review the procedure again with you in detail. Once we have made sure that all the paperwork is in order, then your child goes back to the operating room.
So the procedure is performed as a team. I work with Dr. Gacciani, and there's another number of parts to the process. The first part, when the patient gets in the room, the anesthesiologist is doing a lot of work, putting in lines and monitoring devices. And then we start the procedure, and that involves an incision on the top of the scalp. We go down to the bone, the skull bone, which is covering over the brain. We make cuts in that bone, and then after that bone is taken off, then we make cuts in that bone again and remodel it into a better shape. The skull is expanded out when we're doing that, and then we put that bone back in place with plates and screws. Now, the plates and screws we use on a kid are resorbable, so they won't be there long term with the child. They're made of a material that usually takes about a year to dissolve. They'll put the bone in place, and then when everything heals, those plates will go away. After the surgery, we go out and talk to the family, and at that point, the child is going up to the pediatric intensive care unit.
The pediatric ICU doctor takes care of all your child requirements, both for medications, any fluids they will need, any blood transfusions they will need. We do visit with your child at least twice a day, and when the child is eating well, when the pain is well controlled, your child will go to the regular pediatric floor, and then usually the entire hospital stay entails about 1 to 2 days in the ICU and 1 to 2 days in the regular floor, and then we let you go home.
His individual surgery went faster than they originally said. It was supposed to be a 3 to 4 hour surgery, and they were done in 2 hours. So it went very well on that end. Everything was fine. He came out and didn't even have the tube in him once he came out of the actual surgery for ventilation. Got back into ICU, and I think we saw him about 4.5 hours finally after the surgery was over. So everything went good, everything was perfect, no issues with anything on the line, so very good.
The plates are doing what they want, what the doctors want them to, and his suture line is starting to fade, but that's still going to take a couple weeks to go away.
And then from what Dr. Maurice was saying, that he'll see him probably on at least a 6 month to yearly basis for at least 5 to 7 years, just to make sure there's no additional formation or anything along those lines and everything is going smoothly.
So at Mercy Medical Center, we're dedicated to taking care of kids with craniosynostosis. We have a team. I'm the craniofacial surgeon. Dr. Gacciani is the pediatric neurosurgeon. And that's really the standard of care in taking care of kids with craniosynostosis. And then we have a dedicated team. We have a team of anesthesiologists who are dedicated to taking care of pediatric patients. We have a pediatric intensive care unit, which does a great job of taking care of these patients after the surgery, and then the pediatricians on the pediatric floor. So we have a team that's dedicated to taking care of these children.
And so your child gets really good care both in the process of preparing you for the operation, during the operation, as well as after the operation.
Everything's been phenomenal, yeah, no issues. Everything from the doctors to the staff, the nurses, have been great. Everybody was nice and helpful.